Good afternoon and welcome to 3 o'clock with SOC. Give me a second while I welcome our Spanish-speaking neighbors. Buenas tardes y bienvenidos a 3 p.m. con SOC. Si quieren acceso al programa en español, por favor marquen el número que aparece en la pantalla, que es 646-749-3122. Cuando le contestan la llamada, por favor comparten el contraseña 779-9328-221. Thank you for being with us this Wednesday, August 12th. My name is Tammy Baldwin. I'm the Executive Director and Lead Organizer for SOC, Southside Organizing Center, or SOC. Please know that we are available for you in all the ways we always have been. You can reach us at 414-672-8090. You can email us at soc@socmilwaukee.org. And you can visit our website where we have a page dedicated to information resources and ways you can take action in response to the coronavirus, trying to help you all and us manage all of that information that keeps coming in and all the changes. So please take advantage of that. Folks, we can't be with you in person yet, even though the city has moved to phase 4, a more open status for the city, because 53215, the zip code area, is in a spike of cases of COVID, and that's where our office is. Many of our staff, including myself, live in that area, and many of you live in that area. And so we're going to err on the side of caution and not quite be able to see you in person yet. We're still calling you. We're doing contactless programming. And we have all the digital ways you can connect with us on all our social media, and especially here at the forum. Please remember that if you appreciate the forum in any way, you can show your appreciation by filling out our survey. It's only 3 questions long. It takes less than 5 minutes. It allows you to give us input. It allows us to know what we're doing well, what we can change, and it allows our funders to know that we're getting your feedback and input. So please do fill it out. We really would appreciate that. Folks, you will see us on the screen, most of us without our masks, because as I said, we're all working virtually from home. We're not in person. So I'm alone in my fireplace room, and so that's why I don't have a mask on. But believe me, we're cooperating with all the safety guidelines. Please know that the views and opinions shared on the program may or may not necessarily reflect those of SOC, as we create safe space to have dialogue about some very heavy and controversial issues sometimes. Before we get started and invite on the senator, I'd like to see who's with us today. If you can see a hello. We can see the number of people here, but we can't see you unless you make a little comment. So hola Trine, hola Diana. We got some faithful super fans, super participants, and we're grateful for that. All right, folks. Before I bring on the senator, I want to make some critical announcements. You heard me say this earlier in the week. We are approaching our 100th episode of 3 o'clock with SOC. As a matter of fact, the actual date is the 25th, August 25th, and we're going to celebrate. We're going to do some of the recommendations that you all had. One was, let's have a Zoom party. So we are. There'll be a registration link that you can respond to shortly in the next day or two. The first 100 residents from our district who register will be mailed a commemorative face mask that has our logo and the 100th episode stamped on it, a cloth one. So you'll want to pay attention, and then you'll be invited to the Zoom, and we'll be sharing a little more about what will take place at our 100th fiesta soon, just to give you a heads up. All right, today, following up on law enforcement reform and the activities of the FPC and MPD, the Fire and Police Commission issued their announcement for the search of a new chief of police. And so as soon as we get those links, we'll share them with you. Right now, it's email and a document. But as soon as the FPC posts it on their site or social media, we'll share that link so that you could see what that is. I'm just going to share a couple of pieces of information, the timeline. So here we go on today. The applications are officially open locally and nationally. And then the deadline to submit is Friday, September 11th. Applications by the close of 4:45. So that's some critical information. And later on in the week, I'll continue to share a little more because we want to take advantage of the senator being with us and giving you access to her. And then the last thing I want to announce is that the Milwaukee Police Department had a press conference today, and the acting chief Brunson described how he wants to move forward. And so we want to be able to respond to that as a member of the Community Collaborative Commission. I'm still getting used to our new title. And then I'll have more information on that for you in the next day or so. All right, we are continuing our theme this week of talking with the new generation of organizers and get out the vote. And with us today, we'll have Senator Baldwin in just a second. Tomorrow we have Devin Anderson from the African American Roundtable. And Friday we have Dakota Hall, the Executive Director of Leaders Igniting Transformation. So with that, let's get to our very special guest, Senator Baldwin, Senator Tammy Baldwin.
Well, I'm thrilled to join you. Hello. Hello.
Hola, Senator Baldwin. So good to see you. You've been such a great amiga to our community, and we appreciate you.
Well, I appreciate your leadership and convening everyone for a conversation. So really, I'm grateful.
Thank you. Thank you. So, Senator, one of the things we're trying to do with our featured guests is help our residents understand the roles that you're serving in. Could you talk a little bit about your role as a senator?
Absolutely. So I work at the federal level. Although I have experience earlier on in my adult life of serving in local government and state government, so maybe that makes it easier to talk about the different levels that there are. But at this point, I was elected to the United States Senate in 2012 and reelected in 2018 by the people of Wisconsin, the voters of Wisconsin. And I view my role as being a representative of the people of the state, as well as an advocate for the state to move forward, to make things better, address problems. And one of the key things that I view in my role is listening. And so you've given me an extraordinary opportunity to have a conversation, but I get so much also out of conversations I have where people are sharing their experiences, their challenges, their aspirations across the state of Wisconsin. I view myself as an advocate for the state in Washington, D.C., by moving to protect our precious resources, starting with our people, and having policies enacted that respect the dignity of work and allowing hard work to get people ahead. I'm a fierce advocate for healthcare availability and affordability and quality. And I also have a big focus on our precious natural resources. We're a state on the coast of two of the Great Lakes. We also have a lot of precious inland waterways, and the access to safe drinking water, clean water, is vital to life and vital to all of us. So those are some of the things that I focus on, particularly with regard to issues. But my role in Washington, D.C. is one of a lawmaker. I introduce proposals, legislative proposals, and try to see them passed and signed into law by the president. Of course, the lawmaking process involves first introducing a bill. It has to be passed by both houses of Congress, the House of Representatives and the Senate, and then signed by the president in order to become law. And I have a lot of priorities that dovetail with the issues I was just talking about in representing the state of Wisconsin and the people of Wisconsin. And then we also have very much an oversight function. When a program is enacted, we are responsible through our committees to bring in witnesses and see if what we were endeavoring to accomplish is really happening, hold people accountable for wise use of taxpayer dollars. And then there's another sort of individual advocacy role that I just want to put in a quick plug for. When people have problems with or questions about federal agencies, we actually have caseworkers who help people navigate the system, because it can be very complicated, and whether that's someone helping somebody who has a case in the Veterans Administration, or Social Security, or Medicare, any of these federal programs, we try to help people sort those things out and get answers, and whenever possible, a successful result.
That's great. You're right. There's so many levels of government, and it can be easily confused who has what responsibility at what level. So thank you for sharing that. I'm sure that's a great help to our viewers. Senator, we wanted, and you offered to give us an update on what's happening with the COVID-19 response. Please share with us.
Yes. So what I would start by saying is that this many months into the pandemic, things are clearly getting worse, not better. And I am concerned and actually quite angry with the lack of leadership that I have seen in the presidential administration of Donald Trump. I hate to start out with that, but there are many actions that should have been taken at the national level that simply weren't. And to this day, I continue to press the Trump administration to take those actions so that we can finally see the numbers of COVID-19 cases begin to decline again, and ultimately decline to the extent that we can manage this illness and get to the other side of this pandemic. We have had several bills, several pieces of legislation pass the Congress and get signed into law since the pandemic began, looking at different aspects of the pandemic. So early on, there was a significant allocation of money for research, so we understood it, how it was transmitted, how you fight it, as well as a dedication of dollars for research on a vaccine, because obviously that would prevent the illness if and when we have a vaccine that's widely available. But the additional measures that have passed include things that focus on not only the public health crisis, but the economic crisis that has accompanied it. Because to stop the spread, we have had a lot of changes in the way our economy works. And for a time, the economy was largely closed down, except for those who were deemed essential workers. So the biggest piece of legislation that was passed back in the end of March was called the CARES Act. And among the many focuses, there was support for individuals who are unemployed, and a significant federal infusion of dollars for those individuals, as well as an expansion of eligibility. Historically, people who are self-employed or work, say, in the what's known as the gig economy, had no eligibility for unemployment. And we expanded eligibility because we know that the layoffs and furloughs are beyond the control of people. It's nobody's fault that we have a pandemic, and we needed to be standing by unemployed workers. The other thing was the direct stimulus payments to individuals and families, and support for small businesses through the Small Business Administration and something called the PPP program, or the Paycheck Protection Program. Those are the ones that I wanted to highlight at first, because those were some of the biggest parts of this CARES Act legislation. But I also want to acknowledge that the implementation of these programs that I mentioned was far from flawless. It was, in fact, fairly troubled in some of these cases. And whether it was because the agencies that administer these programs were overwhelmed and backlogged, we often didn't see timely distribution of resources, or sometimes it was the way the administration implemented things to make it easier for some and more difficult for others to access the resources that were intended to support Americans in a time of crisis. So part of what we've been doing since then is trying to address the flaws in the CARES Act. And now that the pandemic is getting worse, not better, we know that we need to extend and improve many of the programs that were passed in the CARES Act, some of which have actually expired, because the hope was back in March that we would be getting much better. The pandemic would be losing its, we would flatten the curve, I think is the way it's usually put. But in Wisconsin, last Saturday, we once again had a record number of new positive coronavirus tests in the state. It seems like every time we hit a staggering number, a short while later, we see it getting worse. And I really feel that the stall right now of negotiations on a new package is really leaving Wisconsinites and folks throughout the U.S. In very difficult, extenuating circumstances, and that we must act. So I'm here in Washington, D.C. as we speak today, working to push for additional legislation, additional relief, and pursuing some policies that I think the administration should have tackled way back in February and March, and they still haven't tackled to this day. Why don't I pause here? I don't want to necessarily go through all the details of the things that we're pushing for, because I want to steer my comments to what you're most interested in.
Absolutely. Let me invite our viewers. Senator, we have an average of about 600 people who see this forum over the period of time since we've existed. You might have heard that we're headed to our 100th episode very soon on the 25th. And so shortly after, thank you. Shortly after the pandemic, we realized our residents needed us more than ever. And so we went digital. So I want to invite our viewers, if you have a question for the senator, please share it and let's really take advantage of her presence and time here with us. Senator, The CARES Act was important. Thank you for the update on where that is and the things that are of concern to you and the residents. Let's lift up, I know you wanted to talk about especially how we protect workers
Yes.
during this pandemic, especially those on the front line. And so share a little bit about that. And then after that, we'll head into protecting the vote.
Right. Okay, so one of the sharp criticisms I have of the Trump administration is that during this pandemic, the lead organization for protecting workers, which is called the Occupational Safety and Health Administration, their job is to issue enforceable regulations to keep people safe in the workplace. And that, of course, includes customers who enter into workplaces also to do business. They have failed to issue any enforceable regulation since the beginning of this pandemic. Utterly failed. What people can look at when they're looking at keeping themselves safe is voluntary guidance, as it's known. And the two organizations, OSHA has some voluntary guidance. Also, the Centers for Disease Control has voluntary guidance. But if you're a worker and you think you need a mask and your employer isn't providing them because it's only a voluntary guideline, you have no recourse. And in fact, oftentimes we've seen frontline workers who have complained be on the, be retaliated against by their supervisor or the head of the company. And that's just wrong. So I wrote a bill called the Every Worker Protection Act that simply requires OSHA, the Occupational Safety and Health Administration, to do its job and issue enforceable rules, standards, so that we can continue to reopen our economy in a way that is safe for workers and safe for the people who interact in these workplaces. I am especially concerned about essential workers who work in health facilities, whether those are hospitals or nursing homes or assisted living facilities, where we've seen significant spread of the coronavirus. And oftentimes we've seen desperate shortages of the type of personal protective equipment that people need to stay safe. And this is something that leaves workers without recourse. If they don't have an enforceable standard, they can't call a government agency and say, my workplace is unsafe and I want you to do something about it. Help me do something about it. We saw this also throughout the state and throughout the country in jobs that are part of the food supply chain. So outbreaks in meat packing facilities. And again, at a time when safety and health experts should have been requiring the best practices, the safest practices. In fact, we saw some actions taken at the federal level that were counterproductive, forcing people to work when they were unsure of their health status, not having sufficient testing and masks, and even one that is, you have to think about it to understand how it works, but in some cases they were trying to speed up the production line, which usually in a packing facility means that workers are going to get closer and closer together in proximity to one another, again, creating the opportunity for spread of the coronavirus and the COVID-19 disease. I think that, again, I'm highly critical of the failure of leadership of the Trump administration to do this. They don't need a bill to be passed to promulgate an enforceable regulation. But they haven't done their job, and so I've introduced this bill to force them to do this job. A second and related issue that I'm working on is addressing the inadequate supplies we have of things like tests, testing swabs, specimen vessels, reagents, all of which we need if we're going to do a better job of testing and thereby a better job of winning over this coronavirus. And the president has the ability to use a law that's on the books already to increase dramatically the supply of things like masks and gloves, paper gowns, tests, and all the supplies needed to conduct tests. And it's a pretty significant law that goes from assessing the national need, assessing the national supply, filling that gap between need and supply by literally ordering appropriate manufacturers to start domestically manufacturing what we need. And then it gives, the president already has the authority to be in charge of distribution. And so I introduced a bill, the Medical Supply Transparency and Delivery Act, which would require that to start happening. And again, it's infuriating to me that we are in mid-August of a pandemic that began to present itself in the US in late January and early February. And I still talk on a daily basis with people who are needing to reuse a mask for weeks at a time, who are not supplied with the type of equipment they need to stay safe and to keep their patients and their families and their pupils, what have you, safe. So those are two really high priorities I have to get our arms around this, this pandemic.
Well, we're going to make sure to do on our end, Senator, and my staff is already on it. So thank you, Andrea, is to share the voluntary recommendations from OSHA and CDC at the moment, and to share links for your legislation so folks can understand what's happening. I'm going to say hello to Maria Alicia and Eloina, who have joined us. When you speak of worker rights, Senator, you know, it just reminds me how we still have to fight for worker rights, even since locally we had the Bayview Massacre in 1886. But we're still demanding worker rights. And that's a tragedy in and of itself that we're still demanding that. And then maybe you don't have this question, but what I was thinking of when you were saying that is, if we are not going to mandate employers to keep their employees safe, my assumption is they have some room to sue their employer if they're endangered by COVID. I would assume. Does that avenue exist for workers? Because I know there was some talk about giving employers waivers or some kind of coverage, but can you speak to that?
I can. So these the right to pursue justice after a workplace illness or injury is sort of, it's different in every state, but Wisconsin has a body of law, and it's called tort law, T-O-R-T law, which is basically based on other cases that have been decided. And certainly there are some laws on the books also, but most of the time this is case law, a body of case law from cases that have come before. And usually there's a standard of showing that this was willful or negligent conduct on behalf of an employer in order to get injury. We also have something called workers' compensation, which is a standing program that tries to address injury or illness at the workplace outside of the court setting, so that because employers put into that system somebody who becomes ill or injured on the job has a right to some compensation. And it's obviously easier to deal with a system like that than it is to hire your attorney and get into long litigation. Now, you were talking about discussions about immunity from liability. And that, to me, I was shocked when I heard that was Senate Leader Mitch McConnell's highest priority in the next COVID relief package or legislation, because you need to have strong incentives to implement the best practices to have the safest workplace you possibly can. And if you say there's immunity from any responsibility for doing that, many, certainly not all, but some will say, well, I want to do this as cheaply as I can. And since I don't have to do anything, and it shows, going back to how important it would be to have enforceable standards, because then you at least have something that you can say, well, you failed to do this, and we told you that you had to do this. Therefore, you know, it might make sense to have some discussion if you can say, these are the standards, we met all of them, and nevertheless somebody thinks they became ill at work. But I just think the conversation without standards that are enforceable makes very little sense. I think that it is one of those issues where we've reached an absolute impasse in negotiations. I know that for some people, immunity from liability is a non-starter, especially as broadly as it was written. And then, you know, Mitch McConnell says this is his highest priority to include it. One of the things I might add that was just staggering when I looked at the details of the proposed legislation, they were saying that it would include up to 5 years of immunity from medical malpractice liability, whether or not the malpractice was related to treatment of COVID-19. And the rationale that was provided for that was, you know, if, I'm going to use a dramatic example, but they amputated the wrong leg in a surgery, that the excuse was, well, our hospital was kind of distracted because we were dealing with all these cases of COVID-19. So that doesn't fly. That just doesn't fly. And I don't think we should be looking at any legislation so poorly drafted that would make it hard for people to seek justice or seek to be made whole after an illness or injury.
Thank you for that. A lot of information I heard for the first time and understood better. So I really appreciate it. One of the elders of our communities chiming in, Esperanza Gutierrez. Thank you, Senator, for your service. Please keep your efforts in keeping safe and the release of children under federal custody due to their parents seeking asylum. Maybe we'll have you just speak to that really briefly, Senator, because I know we're almost out at time. And then maybe you could speak a little bit about get out the vote. So if you could respond to Esperanza Gutierrez.
Yes. So I fear with all of the fallout from the pandemic and so many issues of injustice and lack of equity, that the attention of the public has left this crisis that we also have with regard to the asylum-seeking process, the how we could forget, and I hope we never do, the separation of parents and children, especially young children. And the conditions were such that in a pandemic, you can imagine that spread of the coronavirus would be very much heightened by the conditions we saw when the cameras were there, but the crisis still exists, and frankly, it is yet another failure of this administration. The safety and health of anyone who is seeking, which they have the right to do, seeking asylum in this country, needs to be a paramount responsibility of government not to endanger it further.
Yes, agreed. And with a few minutes of however much time you can spare, Senator, talk about your efforts to keep the vote protected.
Yes. So there's so many dimensions of this issue, and I want to just cover several of them. First of all, we have had a systematic effort over many years in the state of Wisconsin and certain other states to diminish people's access to the ballot box. In a state like Wisconsin, since the beginning of the last decade, this past decade, we have seen acts like redistricting or gerrymandering the state in a way where the legislature has become very much dominated by one party, by the Republicans artfully drafting a map that concentrates Democratic voters in a small number of districts and allows for a lack of meaningful representation if you look at the overall votes cast. So that's a very troubling aspect. It's kind of hard to explain, but we only draw the maps once every decade after the census. And so we are soon going to have another opportunity to redistrict in the state of Wisconsin, and an opportunity I hope and pray will be just and equitable and fair so that everyone's voices is equally heard, which does remind me everyone needs to fill out the census. It's so important that we be counted, or if we're not, it has serious ramifications for the allocation of funding and the allocation of electoral representation. So that's the redistricting. But also in this last decade, we saw efforts to curtail early voting opportunities, where in a pandemic, people can make sure that they can vote in person in a time where there's not a long line, a crush of people trying to get their ballots in. We have seen the legislature impose photo identification requirements that are onerous for people who, for example, don't have a driver's license and depend on transit or can't get a driver's license. The issues are very significant, and they tend to disenfranchise disproportionately folks of color in the Hispanic community and the Black community. They tend to disenfranchise the elderly and the very young voters who have just reached adulthood. And so we recognize that those barriers have been imposed. And at the federal level, one thing that I would love to see passed is the Voting Rights Restoration Act, which would outlaw some of those activities at the state level if they are proven to diminish the voice of any constituency based on race, ethnicity, or partisanship, frankly. And the Voting Rights Restoration Act has been renamed in honor of Congressman John Lewis, who recently passed away after long service in the Congress, and prior to that, a long period of activism around the right to vote and making sure that it is not interfered with. And so there could be nothing more fitting than naming the Voting Rights Restoration Act after someone who literally put his life on the line to help people gain access to the ballots. I will also say one other thing, if I still have time, and
sure,
that
absolutely.
is, we're also very attuned to passing and advancing legislation at the federal level to help states and localities operate a safe and healthy election during a pandemic. And that, in many cases, means additional resources. The CARES Act got to start with $400 million to the states. The proposal that I'm pushing actually has almost 10 times that much money, because we know that if there is increased demand for voting through absentee balloting, that there will need to be changes made to cover the cost of postage, both to the voter and then back to the election official. We know that there will be additional costs related to the management of those absentee ballots. And also, during a pandemic, we also want to make sure that we don't see what happened in Milwaukee on April 7th in the primary, where what used to be 181 polling places were consolidated to 5. And people then were in long lines. Polling workers were exposed to a lot of people in these 5 locations. We need to do everything we can to reopen even more locations so that those who do vote in person are able to do so without long lines, without long waits, without being in close proximity to others. And so spreading out the polling locations even to a greater extent is vital. And localities need resources to do that. So we are still pressing for additional funding for safe elections this November 3rd. And I would express to all of your participants to make sure you are registered to vote. You can register online, do so early, and as soon as it's available, order an absentee ballot if you can at all.
Senator, you've been a treasure for us today. So much information and encouragement. Thank you for your presence. Be safe, and we look forward to when you can be back with us.
Oh, thank you so much. You be safe also, and all your listeners and viewers.
Adios.
Adios.
All right, folks, we're going to move right on to our COVID section and ask Marlene Zaran, our coronavirus coordinator, to come on. Hola,
Hello.
Marlene.
Hola. Hi, everyone. So I'd like to just start off by saying that we'd like to challenge you for the mask up challenge. So please wear a mask everywhere you go. If that is indoors, like a restaurant or um, any public facility, wear a mask. And if you are in public areas around people, please try to stay 6 feet apart from individuals. Um, so the mask up challenge is essentially you're going to take a selfie of yourself and you're going to post it on your social media platforms. That is including Facebook, Instagram, or Twitter. You're going to take 3 of your closest friends and family members, and you're going to put hashtag mask up. Essentially, this is going to inform everyone around you and those on your social media platforms that they should be wearing their masks everywhere they go. And if they see that you're doing it, maybe they'll do it as well. So that being said, I actually have a video for you guys, and it's pre-recorded with Dr. Amelia Aranes. She is from 16th Street Clinic. She's the director of pediatrics, and I'm going to play that right now. So just give me a second to share my screen.
Hey, Marlene, just so you know, we couldn't hear the video, so that's why I took it off. So we're going to problem solve behind the scenes and see if we can get that back up for you. But for now, we will leave it off and hopefully be able to get it back up maybe at the end, okay?
Okay. 1 second. I think I know what happened.
So I'll just go into my section then, and then let me know if you get that figured out, okay? Cool. So, hey, everybody. Gabe Charles here, Civic Engagement Manager, bringing to you the results of yesterday's election. Thanks again for everybody that was able to get out there and vote. I know it's not the easiest or safest things to do during this pandemic, but I, myself included, wanted to make sure that we exercise our right to vote. So thank you to everybody that got out, whether it was absentee ballots or in person, however you were able to do it. So just going to share some images with you. We had Israel Ramon win the County Register of Deeds, and he has no opponent for the November election, because remember, these primaries just indicate who will move on to have an opponent in their opposite party for the November election. So then moving on to State Assembly District 8, we have Silvia Ortiz Velez that won the Democratic candidacy for State Assembly District 8, and she will face Angel Sanchez as the Republican opponent in the November general election, and that's him. So Angel won the Republican seat for State Assembly District 8, and he will face Silvia Ortiz Velez. Then we have Marisabel Cabrera, who won the Democratic side for State Assembly District 9, and she will face Veronica Diaz in the November general election. And I'm only presenting the ones that are specific to the SOC district, otherwise we'd be here for a long time. And then I'm also only presenting the people who had to compete yesterday within their own party. So Marisabel went up against Christian olvidar, se me olvida, sorry. So that's why I'm presenting this. And then also we have, it's not showing. We have Tim Rogers, who won the Republican seat for the U.S. House District 4. So he will be going up against Gwen Moore as the Democrat in the November election. So those are the major results that we have for all of you. And we will always, as always, keep you up to date with other civic critical updates. And then I also have an exciting guest for all of us today. We have Pua Vang that's coming from the U.S. Census Bureau. So I just want to bring her on to talk a little bit about the census again and about how important it is. You are muted, Pua, so if you could unmute yourself. It unmuted for a second, and then it remuted. Let me see if I can. Looks like we lost her. Hopefully she will be able to log back on. I will see if in the chat, Marlene let us know that her video could go up. Not seeing anything. So I will just pass it back to Tammy and we will figure it out.
Thank you, Gabe. A little sticky today, folks. We haven't had that for a while, but it's to be expected. We're going to skip the video, show it another day, just because we're running out of time. As soon as Gabe lets me know that Pua's sound is working, we'll get them on. I want to remind you all what we're going to be bringing you in the next couple of days. Tomorrow, we have Devin Anderson from the African American Roundtable. You'll want to listen into that because of all this talk about law enforcement and trying to understand what does it mean to defund, reinvest money, fund for safety, etc. And they're doing a lot of work in that area. So I think it helps us all understand what's the spectrum of options that are available for us to move forward in as a safer community and have better police community relations. And then on Friday, we're going to have Dakota Hall, Executive Director of Leaders Igniting Transformation. And wait till you hear how many youth they have involved in the social justice movement. It looks like Pua, who, by the way, worked formally for SOC, so we're happy to see her again, is good to go. So I'll turn it back to Gabe.
Hey, so glad you were able to work that out.
Yes.
No problem. Okay, so thank you so much for being with us. Why don't you just start out by introducing yourself, letting us know what you do with the Census Bureau, and just a little bit about the work you do.
First of all, hi, SOC. I just want to send my acknowledgments for all of the hard work that the agency has been applying in the Near South Side. Your message has reached not just the Near South Side, but throughout Wisconsin also. So I hope you understand and know how empowering the work that you are doing on the community level, how empowering that is for the rest of Wisconsin. And then also acknowledgements to Senator Tammy Baldwin for encouraging everyone to complete their census survey. So my name is Pua Vang. I am a partnership specialist for the United States Census Bureau. And in the very beginning, about a year ago, I was covering about 10 counties worth, encouraging hard to count or hard to reach communities to encourage them to begin to learn about the census survey and how it impacts their daily lives. At this point, I am primarily focusing on the city of Milwaukee, and I am thrilled to be working with several community agencies and local elected officials with encouraging the count. So the city of Milwaukee is one of our harder to count areas, or we have pockets of neighborhoods where it has been traditionally difficult to reach families due to different reasons, such as transiency or there are households who may not understand why it's important to complete the census survey. So I've been working with agencies and having them encourage their service populations to understand the survey as well as complete the survey.
Thank you for all of that. Great to know that we have someone from SOC at a high level that's able to work with these hard to count populations and really help us get the word out. So can you give us just a basic understanding of why it's so important to fill out the census?
I think I can bring it back down to my community organizing roots. When I was working at SOC, I was working under CDBG funding, which we're already talking about now in the city of Milwaukee, with them planning their budget and deciding how they're going to expend these funds. We need to understand from a community level within our 18 NSP areas or neighborhood strategic planning areas, who of these neighborhoods needs the most funding for programming that helps assist them in several different areas. And when you talk about assisting where, you're talking about law enforcement, you're talking about public housing, energy assistance, public schools, school lunches, even healthcare. So places that service community, either low cost or free. Those are necessary things that Milwaukee has identified that needs assistance from the federal level. So CDBG funding, when it does get expended, it gets expended to communities based on the population counts that exist within there. So SOC as an agency utilizes statistics to determine how many people they need to serve, or and then for which reasons. And it's important for us to pay attention to how this federal funding trickles down to our immediate communities. And when we forget to count ourselves, it's similar to an analogy that I've been sharing with some families. It's like a family throwing a dinner for 5 children. A mother says, I have $25 to feed all 5 of you. We're having A, B, C, D, E as our options for dinner. And how many of you want mashed potatoes? And 2 raise their hands. The other 3 say, no. So we add on the separate dishes. And then by the time the mother serves the dinner, she's budgeted out to serve this family. And the children who didn't raise their hands earlier for all of the fixings look at the plates and they just think, oh my goodness, I want that too. Well, the mom has to say, I'm sorry, you're too late. I already estimated my budget and we already took a survey to see how many people needed, how many children wanted this for their dinner. And that means these 3 other children are left out. This is sort of similar to the census survey count because the federal government is taking a survey of who's here now. Therefore, for the next 10 years, they're going to decide from this count how much federal funding they might have to expend each year and allocate each year to federal programming. And so when there's an excess of people who are coming in for a pocket of funding, say we talk about even just the home repair funds that the neighborhood does provide through the cities, through the city. If the population has decided that there's going to be about $2 million worth of home repair funds available to the community, they're going to be basing that on, whoever kind of completed the survey. But if there's an excess of people coming through, they're not going to really know where they came from because some of those people may not have been counted. So you want to count yourself first so that when the funding does come through, no one is apologizing to you as a community, apologizing to you about, I'm sorry, the wait lists are full. And those are the things that we keep seeing on a local level is, I'm sorry that the wait list for Section 8 housing is full. I'm sorry, energy assistance is full. And so we want to prevent those things. And these are the reasons why we need to count ourselves, count our households, count everyone that lives with us.
Thank you so much for bringing it down to an understandable level like that, because I think something like the census, where it's, people telling you left and right, fill out the census, it's federal funding is determined by it, your representation politically is determined by it. I think it's hard to conceptualize such an abstract thing, but you really did a great job of bringing it down to the level of the community, and really cool that you could even bring it back down to your time with SOC and how that funding gets divided up to even organizations like ours. So really, thank you for that. Something else that we run into in the work that we do with SOC specifically is having people express to us that they fear filling out the census for whether it's because they don't have papers or not, or they just prefer the government not have their personal information. So what message can you leave with us just to calm people's fears or nerves around that topic of confidentiality or privacy?
On a federal level, we've been shared that even getting into this job, we've sworn ourselves to maintaining the confidentiality of anybody that we come across. So we've sworn to maintain the information, private information of individuals whom we come across. So if I'm talking to you today, I collect your information just for conversation purposes about you wanting a job with the census. I can't pass that on to anyone else. It basically just goes into the system and it stays there. But your information is protected by a U.S. Code Title 13 for up to 72 years, which means your information is locked away for 72 years. Your information is aggregated with the community surrounding you. Therefore, if anyone wants specific data of when you filled out the census, who was included in your census, including their personal information, that information is only going to be compiled as part of your neighborhood. And you can't zoom into Gabe's house and see that Gabe filled out the survey and Gabe showed that she had 1, 2, or 3 additional people. So up to 72 years, your information is confidential and it's punishable by law for any of our census employees who decide that they're going to pass information along.
Thank you so much for that clarification. And yeah, I know a lot of people may worry with their landlord or something. Oh, my landlord might find out that I have more people living here than I said. And so that's really important information to share out. Well, Pua, thank you so much for being with us. Is there any last things you want to share? Otherwise, we look forward to having you on again in the future.
Sure. I'm happy to just say we're grateful to continue to be working with Southside Organizing Committee for the census efforts. And at this time, as of this past Sunday, the non-response follow-up operations have begun, which means as you are out in your neighborhood, you will be seeing census workers who were hired out of your community knocking at doors of homes where surveys may not have been completed. So if there are any fears as to whether or not these people should be in the neighborhood, they should have identification with them. They should be with face masks. They'll have a tablet, and they're strictly there for business, just to identify and make sure that no one is falsifying their service in the neighborhood. No one should be asking for any personally identifiable information, no social security numbers, no credit card numbers, not asking for any identification of who you are. So be on the lookout for census workers. We're excited. There are about 2,000 being hired for the city of, or the county of Milwaukee, and
Good.
They're already out in the neighborhood. So
awesome. Well, thank you for that update, and you take care and have a good rest of your day.
Thank you. You too. Good luck to SOC.
Thank you. All right, folks, I'll send it back over to Tammy to close out. I know we're a little over time, but we had some great talks today, so sorry about that.
Thank you, Gabe. Thank you, Pua. Great to see you. Folks, I want to first of all acknowledge a couple of you who came in after I said hello. Hola, Marcela. I see your note. Yes, voter suppression is a real threat to democracy. It certainly is. Hola, Maria Alicia. I also want to thank you folks who are listening in Spanish, and let us know when the line goes down and when it comes back up. You're the best partners. You just are always on the same team with all of us, and we appreciate you greatly. Folks, I want to remind you, I told you who was coming tomorrow and the next day, and then next week, every day, we're going to highlight the team who's going to be taking over that day for the forum. So Monday through Friday, you don't want to miss that. Because we're over time, I won't share the details. I'll do that tomorrow. Also, we want to share our solidarity continues with the protesters, ensuring to keep the voice lifted up for law enforcement reform against police brutality, and for racial justice to be achieved finally in this country. And that our thoughts and prayers are with those of you who've been impacted by COVID, especially those of you who suffered the loss of a loved one or a friend. Thank you. Be safe. And we'll leave you with our thank you video for our partners.
Hello, SOC viewers. My name is Micaela. I am a youth organizer. We would like to thank everyone for supporting our 3 o'clock with SOC live show for completing our surveys, in addition to thanking our residents for tuning in and sharing our show. We would also like to thank the following sponsors: Wisconsin Voices, Community Development Block Grants, Neo-Philanthropy, State Infrastructures Funds, Movement Voters Project, Catholic Campaign for Human Development, Zibber Foundation, City of Milwaukee Office of Violence Prevention, Tides Foundation, City of Milwaukee's Promise Zones, all the faithful individuals who supported SOC through their personal donations. Thank you.